We will talk about sprain. And when we say sprain and strain in daily life, we mean soft tissue injury around joints. But if we say sprain medically, it means injury of ligaments. And ligaments is fibrous tissue which connects to bones. When we say strain, we mean injury of muscles or tendons. And tendons are also fibrous tissue which looks like ligaments, but it connects bone to muscle. Most common examples of sprain is knee sprain, ankle sprain, and wrist sprain. And most common examples of strain is back strain, hamstring strain, and tennis elbow strain. It is called tennis elbow strain because it happens most commonly during playing tennis. What is main mechanism of sprain? Main mechanism is forced joint from its normal range of motion, and it causes stretching of joint and damage and injury of ligament. It causes inflammation, it causes physical trauma, and also causes bleeding. And when we have bleeding, we have visible bruising also. So, what are the most common symptoms? Pain is universal symptom. It is almost 100% of cases. Swelling is also presented in most cases, and bruising develops after some period of time, maybe after 24 hours or 48 hours, it depends. But bruising also develops, and bruising also important characteristic of sprain. Sprain can be mild, moderate, or severe, or grade 1, grade 2, and grade 3. It's important because mild and moderate have almost similar treatment, but if there is severe sprain, there is different type of treatment. That's why they are important. It's important to differentiate when you have trauma. It's important to differentiate it's mild, moderate, or severe. What happens in mild cases? Mild cases we have microscopic trauma and not very important. We have discomfort in the joint, but joint is fully functional. We have discomfort during activity, but person will call it discomfort more than pain. So it's mild. If person says that he has or she has discomfort during movement in the joint, it's a mild sprain. If person says that it's acute pain and it's severe pain during movement, it's moderate usually, and most cases we have moderate type of sprain, which is grade 2, and it has pain when you pressure, pain when you move this joint. Bruising sometimes is visible, sometimes less visible, but in most cases we have bruising also. And but this joint is functional, still functional, even it's painful. And in severe cases we have complete tear of ligament. That's important because if there is complete tear of ligament, it requires surgery. Pain is very severe, and during this injury time, during this trauma, there is pop sound which is visible for person, and this pop sound is tearing of ligament, and this pop sound is sign of this severe injury of ligament. Joint is not functional at this case, and there is extensive bruising and extensive severe pain, and person is unable to walk or to use his foot and or his leg or his joint. It's severe, very severe, so it requires surgery. And in most cases we have grade 1 and grade 2 sprains, mild and moderate sprains, during fall down, just fall down. Usually it's grade 2 or grade 1. It's more common among women generally, and young people and old people, because their ligaments are less flexible and their muscles are weaker. That's why it's more common among older population and also among sportsmen and athletes. Grade 3 happens in intensive sport, when we have severe sport collisions, for example in rugby, also from accident, car injury for example, and or fall down from height, for example fall down from ladder. And among risk factors, also important is shoes. Pay attention your shoes. If it's slippery sole and smooth sole and worn out soles, you need avoid such shoes, because in many times and in many cases cause of sprain is shoes. That's why you should pay it attention. Now let's say what is treatment. Standard treatment method is R.I.C.E method, which means rest, ice, compressions and elevation. Rest means you should use less your injured knee, for example, or injured ankle. You should avoid pain, so rest is important. Ice packs for 20 minutes several times per day is possible, and compression stocking also impossible to reduce swelling, and elevation also for reduced swelling and inflammation. Ibuprofen, naproxen and paracetamol. Ibuprofen or naproxen or paracetamol is recommended for relief pain. Brace and immobilization of knee, or if this trauma is severe enough, it requires immobilization and brace. But in many cases, when we have severe trauma or complete tear of ligament, surgery is required. But if it's grade 2, or if it's mild or moderate, or even in many cases if it's grade 3 and it's severe, immobilization in many cases is enough. But if we have complete tear of ligaments, surgery is required. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.